I grew up in Chicago, Illinois. That's where I was born and raised. One of my uncles was a physician growing up, and when my parents were working late hours, they left me with my uncle. He sometimes took me with him to the hospital, and so he would leave me with the nurses or at the lab, and I would look at stuff under a microscope at maybe 5, 6 years old, and started to fall in love with medicine. I went to school at University of Illinois in Chicago. I went to medical school at Ohio State. Then I moved to Detroit, Michigan, where I met my fiance, and that's where I did my residency at Beaumont Hospital. I knew I wanted to work with my hands as I was kind of going through medical school, but I knew that there was room for kind of being able to understand the patient's experience in a more personal way and kind of being able to provide that level of comfort. And urology, because of its nature of having association with very sensitive topics, does provide that kind of very close patient relationship. And it's also one of the fields where short procedures can have a huge life-changing impact. Me and my fiance were looking for a change. We'd been in Detroit for the last 4 or 5 years, and we were looking to be outdoors in the winter and kind of be more active, especially in the off seasons. We love to ski, we love to hike, and we have 2 small dogs that like to be outdoors as well. I'm passionate about kidney stone surgery. I love doing endoscopic work, whether that's small or large stones. I'm very interested in doing surgery for enlarged prostates. We have a number of different modalities, and I try to specialize in most of those. I do really enjoy robotic surgery for cancer, whether that's prostate cancer, kidney cancer, reconstructive surgery, and as a special subset, I do take graft from the mouth for reconstructive surgery, which is kind of a unique skill set in the field. I do enjoy also working on stress urinary incontinence, whether that's male or female. I think that can have a huge life-changing impact on patients. I've loved working at Urology Associates. We have a really great group of doctors and PAs that we work with. Our staff is super supportive, and the feedback that I'm getting from patients is that they love interacting with the staff here. Yeah, so my personal philosophy on patient care is a patient-centered approach to medicine. So I like to make sure that you understand all the options, whether they're the right option for you or not, and allow you to make the decision and feel personally empowered to make that choice because you have all the information that you need.